Hi, I'm Bob Roth, Managing Partner and Co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show.
Welcome back to Health Futures. I'm your host, Bob Roth, and I'm real excited today. I have a return guest. She hasn't been here for 3.5 years. It's just crazy. She has not, and we need to put an end to that now, and specifically here today. And I'm really pleased to have in the studio with me Dr. Tiffany Pankow. Tiffany, welcome.
Thank you. It's a pleasure to be back. Thank you for having me.
Well, it's great to have you back here. And you were here on my show when we were doing radio and podcasting back in a different role than you are today. And I'm excited about learning about what you're doing. So rather than me try to fumble through what your role is today, tell me what you're doing over at HonorHealth. You're making a difference in the lives of so many that are working there and doing the good work here in our community.
Yeah, well, I have the privilege to have sort of a unique role at HonorHealth. I'm a Vice President, Chief of Caregiver Wellness and Patient Experience. And what that role really does is tie that the well-being of our caregivers, all of our employees, whether you're at the bedside or whether you're in IT or food services, you have an impact on our patients. And the well-being of our employees is going to impact the experience and the well-being of our patients. And so that's really the goal of my role, is to support both those areas of the organization.
I love that. And I want to do a deeper dive into this as we get further into our podcast. But I want to frame this for our listeners and our viewers. They may not know who Dr. Tiffany Pankow is. And, I just learned here today as we walked into the studio that you're second generation and you were born and lived less than a mile from here and grew up in this town, especially here in Old Scottsdale.
Yeah, I have deep roots in the community. So as you said, I'm a native of Phoenix, grew up in our Scottsdale school districts, and was able to have my training out of state, but came back for residency. So really wonderful to be, here in Arizona and to be serving the community where I grew up.
It's got to be fun coming back.
Yeah, it is. It's changed. It's certainly changed over the years. We were talking about that. It's amazing to see the change, the growth. And that's part of what HonorHealth is trying to do in terms of serving our growing community. But it's really been amazing to see all the changes in Scottsdale and the whole Phoenix metro area.
I mean, look, you chose medicine, and I want you to take us through that path. But you could have chosen to practice anywhere, but chose to come back here. So tell us a little bit about what made you choose medicine as your career and being a physician and doing the work that you do?
No, I didn't actually have a direct path to medicine. My undergrad was in English and Foreign Affairs and was actually interested in journalism. But what I loved about medicine, obviously, was the science, that piece of things. But what really spoke to my heart was the storytelling and the engagement with our patients and doing sort of that investigative understanding of what's going on and then trying to find a solution for people. So that was really what drove me into medicine. In medical school, I liked a little bit of everything. So family medicine was kind of the perfect fit for me. And I got to be sort of a little bit the jack of all trades, and was always sort of that wide angle lens and like to sort of see all of a patient. To me, I didn't want to just fix one part of them and send them on their way. I really wanted to have a long-term relationship with that patient and really get to know them personally. And so that's been, I think, the thing that's kept me so connected to medicine throughout my career.
Well, and your career, I mean, look, I know that now we're doing video. I mean, you look like you might have just gotten out of high school, but I mean, your career is 25 years? How many years have you been practicing?
Yeah, so I've been back from medical school practicing in the Valley for 25 years.
25 years, wow.
Yeah, so it's been a long trip in the community in a variety of different areas, and been with HonorHealth for the last 11 years, and it's been a really great fit for me.
So in this new role that you're in, and it's not new, it's new to me since you were last here. Caregiver wellness has been your focus area. Can you tell me what led you down this path?
Yeah, I think there's a lot of things that impacted my decision to take on this role. We know that burnout was an issue and a problem with our caregivers at the front line far before the COVID pandemic, but that just exacerbated all of that. I myself, long time ago, back before people were talking about burnout, got to a place in my career where I was really struggling and came very close to leaving medicine. And so when I thought about this role, I didn't want others to be in that space, and I wanted to see what I could do to help make the changes so that people weren't thinking about leaving medicine like I was in the past. And I'm so grateful that I didn't, leave medicine at that time, but I really wanted to be there to support others and help to make it a place where people can practice and thrive and be fulfilled in the work that they do. So that's really what drove me. In my previous role, I did leadership in our primary care offices. And a lot of my focus at that time was really listening to our providers, to our APPs and physicians, and hearing their voices and seeing what could we do to make their jobs easier, to better help support our patients.
That's what I remembered you doing when you were on my show last. We were talking about that. So, I want to just peel back a little bit about HonorHealth. I mean, the fact that they are focusing on the caregiver experience and making sure that, people are living a more balanced life and not being stressed out. Is that unique with HonorHealth? Is that something you see in other healthcare institutions? Do you collaborate with other people serving in the roles that you presently have? Because, it's not something that is just affecting, obviously, the healthcare environment here in Phoenix. It's probably universal.
Yeah, it's nationwide. I mean, I think for HonorHealth, I think we were on the forefront of looking at this. Back before the pandemic, we were talking about peer support. We were talking about how do we support our clinicians in the hospitals and in the clinics before that. And then really partnered with other organizations during the pandemic to try to help support our teams through that. And we are involved in a lot of the national organizations that are focusing on this. And we also have a collaborative in the state of Arizona that I think is really interesting. It's called the Arizona Wellbeing Collaborative.
Oh, I love that.
It started during the pandemic, actually, when different leaders across the different hospital systems in town and other organizations came together to really support the caregivers. And it's continued on. And so now we're trying to learn best practices from each other and share some of those across the network. We know it's important for all the communities to have, every health system. If we want to support our community, we all of us have to be doing some of this work. So HonorHealth has been involved with that, and it's been really fulfilling for me. And I think it's important to share what we're some of the work that we're doing at HonorHealth that I think others can learn from.
Did you, coming into this role, obviously you probably didn't really have any set expectations because you didn't know what you were getting into, but now that you're in it and you've been doing it for a number of years, I'm going to guess probably almost the entire time since I last saw you, because I think you moved in that role right after you and I parted ways. So you've probably been doing this for 3+ years. What have you discovered? What has been like, an aha or surprise to you that you weren't really expecting?
Gosh, I think there's a lot to learn when you come into a new role. We didn't have a role like this, so it's a little bit sort of making it up as you go along. I think one thing is that one size doesn't fit all, right? So when you're really trying to address the well-being of, we're almost at 17,000 employees now, what is a well-being issue for one may be very different for others. And so I've learned that we have to be flexible and we have to really listen to what our caregivers are saying and be responsive to that as much as we possibly can. And I think the other thing that's been really nice is I have a very, very small team. But what's been exciting to me, and I think surprising in some ways, how much everybody steps up to want to be a part of this.
For me, I think about just how people like to, basically hold their emotions and their feelings in, and they really don't want to share those, and they live in that sea of denial. It's not me. Are you in HonorHealth doing things to help bring some of this out and say, hey, if you're feeling this or you're concerned about that? Because I'm sure people aren't volunteering and saying, hey, that's me, but it is them, because you can only deal with the trauma of working with humans and trying to save their lives. And you experience death and a lot of ugliness. It's hard.
Yeah, it is. And I think in healthcare, we're often trained to sort of compartmentalize some of those emotions and some of that, the tragedy that we see. And so it can be tough to really manage those emotions effectively. And so, yes, it's something that we are trying to talk about more. We often, in healthcare, we want to be there to help others, and we don't always think about what we need to do to support ourselves. And so I think the first part is having those conversations, talking about it with you, with others. I think it's something that's starting to happen much more frequently in terms of just having the conversations about mental health and about emotional well-being. And we've done a lot of things within HonorHealth to really try to help support each other in that space. And one of the things I'm really proud of is for our physicians, one of the reasons that physicians and advanced practice practitioners don't seek care for mental health is worrying about licensure and credentialing issues. And so one of the things that we did during my role, we'd already taken some steps, but we went a little bit further, was changing some of our questions that we're asking when people join our medical staff so that we aren't asking stigmatizing questions around mental health. So if people are struggling with those emotions, they can feel much more free to get the help that they need. And do want to put a plug in for our state legislature that also changed some of these credentialing questions for boards and preventing those. And I don't think enough people know about that. And part of why I'm bringing that up is because I think it prevents a lot of folks, nurses, physicians, physical therapists, anyone who has a board certification in the state of Arizona worries about getting to get help because there's often those questions that ask, have you been treated for any mental health or psychological issues?
Right.
And so now those questions can't be asked any further. So I think that's a really great step to help supporting the healthcare workforce.
It is. And it's we have this like conundrum, Tiffany, and when I really think about where we're at is, we have this headwind with workforce shortages. And then we have at the same time, we have people that are really, dealing with stuff. I mean, serious, traumatic at times stuff. And, you have to balance, do I, staff this person and keep them out there on the front line, or do I pull them back and we're all going to be suffering from that? I mean, I'm sure this is something that keeps you up at night. It's really it's a conundrum that we've really got to overcome.
Yeah. I mean, I think we first and foremost just have to support our people and make sure that we have those resources. And I think we do a lot with peer support because the best person often to talk to when you've been in these situations is somebody who knows what you've been through. So we have a pretty robust peer support system that we do training, teaching people how to help each other and how to help their colleagues. Coming together as a team, I think is the strongest way that we can sort of address and face some of those challenges. So
I love that, by the way, peer support. It just makes so much sense.
Yeah.
So, I know you've worked in leadership, obviously, with HonorHealth. And, what's one of the biggest misconceptions people have about leadership roles in medicine?
So I think one of the biggest misconceptions about leadership, at least in my experience and with the leaders that I work with, is that they're somehow detached from the work that goes on at the front line. And I know we don't, sometimes that's the way it's seen. But I think we do a lot as leaders to try to get out there into the front line. And, the other piece that I think is important for leadership here and with HonorHealth is that, we're here and a part of the community. And I think that's one of the big things that drives my leadership is wanting to make sure that we're supporting our community and not just, a leadership that's up in an ivory tower somewhere and not actually part of the work and doing the work. And I think that's something that maybe people don't see about leadership and in healthcare in general, I think, is that there's a lot of leaders that are really wanting to be connected to the community and to the patients. And that's one of the things that I've loved about my role is getting to hear from patients, what we can do better.
Well, I will tell you, in my mind, it's always about the leader. And leadership matters. And, I had HonorHealth's leader here about a month ago. And it's amazing. You talk about somebody that gets in it. He does. He means what he says and he says what he means and he practices what he preaches, all the cliches that you can think about. But I will tell you, I mean, he's a force. And, when you as a leader can demonstrate that, others will follow. And it's amazing how infectious that is. And it does really start from the top. I mean, you got to believe in your leader. And, I admire him, and he's a good friend, and I really admire the organization because I think he's really surrounded himself with really good people. So just to piggyback on one of the things that we talked about when he was here was about the Blue Zone.
Mm-hmm.
So, I know Blue Zone is really big here in Scottsdale, and we are a Blue Zone city.
Mm-hmm.
But you have taken Blue Zone and incorporated that into the infrastructure and internal well-being and health of HonorHealth. So please tell us a little bit about that.
Yeah, absolutely. I would love to. And I think Blue Zones as a whole is really something that spoke to me even before it was here in Scottsdale. When I had patients, our pre-diabetic patients, talking to them about what lifestyle changes they could make. That's when I first learned about the Blue Zones. And so was really thrilled when Todd was talking about bringing it to HonorHealth and what we could do as a work site. And so what our worksite certification is, it's aligned some with the Project Scottsdale, but it's across our entire system. So it's not just our Scottsdale facilities, it's across the entire metro of this worksite certification. And what it is we did a lot of focus groups, we did a lot of surveys, we listened to our people, and then came up with a plan for how can we make the work sites more conducive to making healthy choices. So one of the things about the Blue Zones is that the environment helps to support those, Power 9 behaviors that help to improve longevity and also improve the health span. So not just living longer, but living healthier. And so we really listened to our people to try to come up with that plan, our Blue Zones transformation blueprint.
Oh, I love it.
Yeah. And it's made up of 21 different best practices that we're implementing. It addresses our people, our places, and our policies. And then there are different engagement activities that we include for our workforce, and I can tell you a little bit more about those if you'd like.
I would. I'd like to hear that, because let's face it. I mean, at the end of the day, we all need to be held accountable, and we can have these goals. But I mean, you've heard me say it here before, and I remember talking to you about it a few years back. Is that we're a village, and we need our village, and we need our support, and if we can gamify things, we can, engage people, I think we can accomplish great things together. So yes, I would love to hear.
Yeah. So some of these engagement activities I think are great because they also involve the community. So there's 3 different engagement activities. The first one is volunteering in the community in some capacity. The second one is participating in a Moai, and I think Todd mentioned his walking Moai that he is leading in his community. So a Moai is just a group of people that get together around a shared experience. So we have Moais for healthy potluck lunches. We have book club Moais. We have hiking Moais. We have all different types of Moais that our employees are participating in. And then the last one is purpose workshops. So we know that people that are aligned with their sense of purpose and can do work that is meaningful to them and matters to them, even if it's not 100% of their day, even if it's 20%, we know that will make a big difference in terms of mitigating things like burnout and just overall, life satisfaction. So those are the 3 areas. We're 2 years in right now to what we think will be a 3-year process. And excited to share that we have over 4,600 employees that have already volunteered in the community. 4,600 individual employees that have volunteered in the community. And we're not done. I mean, we're going to continue to do that. And we have lots of those folks that are volunteering, multiple times. Part of our ambassador program is to get involved in the community.
I mean, my quick math says it's about 25% of the workforce.
Yep, it's more than that.
More than 25%.
It's definitely over 25, probably 30, maybe.
Probably 30%.
30%
wow,
or so.
That's impressive.
Yeah, it's great. And then we're our purpose workshops, we've done that for our new employees. And this is that workshop kind of helps you to understand what your gifts are, what your strengths are, and kind of what your passions are, and kind of help you think about making some of those life choices around those. And that one particularly resonates to me. I told you about the time when I almost left medicine. And the thing that kept me working in something that mattered was kept keeping me working in something that mattered, that aligned to my values. And when I started thinking about what other things I could do, I realized that the medicine was really what mattered to me. And so I think it's important to help keep people aligned to their sense of purpose. People come into healthcare really because of a calling. And so if we can kind of get them aligned or back aligned to what really matters to them, I think it's helpful for keeping resilience and helping them feel satisfied.
And healthy.
And healthy.
And healthy at the end of the day.
100%.
So what are some of the other things that is going on? I'm sure it's not just Blue Zone.
No,
So please do share.
So yes, Blue Zones is a lot of it. We have our wellness squad, which we have 800 plus wellness squads. So these are people that are just sort of interested in their own health and wellness and can help be a voice in their area of the organization to get involved. So participating in things like walks and other community events, volunteering, those kinds of things. So leading things individually at the campuses. Those are some of the big things that we're doing around the well-being space. And then there's the whole other side on the patient experience side, which is great too.
Well, it's a great opportunity to talk about patient experience. And, when you and I first started the show, I started talking about your role with caregiving and the misconception is often being that, it is broader than just the internal staff at HonorHealth. It's the community at large. And it's something I know that you think about and certainly the entire team at HonorHealth thinks about when somebody leaves an acute or post-acute setting and they go back home. Are they okay? And, what's that home set up like? And we know that 1/3 of our population, 65 and older, is solo aging. So a lot of people are going home alone. So, I'd love for you to talk a little bit about, caring for the caregiver. And it's really the family caregiver that is laboring. And we know the data, it's about 63 million Americans that are out there doing this hard work every single day.
Yeah, I think caregivers are kind of the unsung heroes in our communities, and they definitely need our support. I know as a family physician seeing patients over 25 years, I often was seeing, the caregivers as well as that person who is going through a tough healthcare issue. And so having to support both of them, I think is really important. And I think if you're in healthcare, you realize that the great impact that caregivers can have, but there can be a toll on them. And so, I think that's important thing of the community is to make sure we're sort of wrapping around the caregiver as well. And I think that's something that when I see patients, and I think that's kind of the heart of what we're trying to do with patient experience as well, is connecting not just with the patient, but who's with them, who's their support system, and making sure that we're addressing some of their needs as well. I think it's a really important area that we should be tackling more and more in healthcare.
Well, I think we have to. I mean, the data shows it. I mean, we're aging at such a rapid rate.
We absolutely are. And you mentioned it a little bit, that aging alone, and I've heard you talk about that and the isolation. We know that loneliness is a huge issue, and our former Surgeon General really brought it to the forefront. But we know that loneliness and social isolation can be the equivalent of smoking 15 cigarettes a day. So that's a really big impact. We talk a lot about hypertension and obesity and what we need to do to address it. But loneliness is as much a factor in chronic disease and mortality. So I'm so glad that you're talking about it and raising awareness, because it's so important. And I think everyone needs to be, a little bit thinking about that. Who's the person in their community or in their life that might be isolated, and what can you do to help?
I just dropped an article in the Jewish News this past week talking about that should be everyone's New Year's resolution, is really looking around them, seeing who might need some assistance. And it may be a family member, it might be a friend, it might be a neighbor. But, somebody is out there struggling and they need help, and we need to be more, how should I say, we need to exhibit more fellowship and more care and compassion and really be helpful. I want to ask a couple questions about primary care, because that's really your background and your heritage and who you are. For many, visiting a primary care physician can feel more transactional. How do you reframe that for visits for patients going forward? Because, when I say primary care, I mean, we all know we got to go in for our annual checkups, and we all know that we need to go in to get our colonoscopy or pap smear or mammogram. But, how do we build more of a relational experience? And, there's a lot of obviously external factors that play into it. And obviously, money recently has really delved into this. So private equity has had an influence on it. But in a typical relationship with a primary care, how do we move that from that transactional experience into more relational?
Yeah, I mean, I think that's a great question. And as we look at healthcare access, I think that also comes into play too, because we all want to be treated when we need to be treated. And I think there is, on the patient side, they don't want to wait. And I totally understand that, and they shouldn't have to. We want to make sure that we're meeting their needs when they have those challenges. But I would encourage people to really look for a primary care physician or advanced practice provider that can really connect with you and listens to you. I think that's the magic. And I do think we have so many primary care providers who truly care about our patients and connect with empathy and compassion. And I think that you can build those relationships. It's just going in and establishing those and trying to see that same person on a long-term basis if possible. I know insurance factors sometimes can impact that, and you're not able to because you've switched insurance plans and those kinds of things. But I think it can be one of the strongest things for your health is to have a primary care provider that you trust. Studies show that there's decrease in trust in healthcare overall after the pandemic, but people still trust their primary care provider. And so I encourage people to establish those relationships and find somebody who, will listen to you and connects with you as a person. I think that's the heart of it. So that's what I would recommend for people is to find that and to invest in it in the sense of returning to that same person. Because from the clinician perspective, if I get to know you over time, it really helps me to make better decisions for your health and to 100%. Be aligned and in a shared decision making, right? Is this the right path for you? Should we do this thing for you? How do we want to treat this problem or this condition? So I think that's an important thing. I also think, being honest with your clinician is really important too.
And I'm so glad you brought that up, because I don't think everybody's forthright with their physicians, and you really need to be. And in the spirit of that, I really, behavioral health is front and forefront. So how do we integrate behavioral health and really whole person care into the standard practice of care with the primary care?
Yeah, and we may have talked about this last time. I don't remember, but we have integrated behavioral health into all of our primary care clinics. So we have a behavioral health manager who is there and can see our patients, and they collaborate with a primary care physician. So if you need to be seeing somebody in behavioral health, they're there in our primary care offices. And I think it really helps to destigmatize the idea of mental health. It's just part of our whole health. It's right there in the clinic. And then again, you have that partner with your primary care physician. And if I can put in a small plug for our physicians,
absolutely.
If you mentioned being transactional, if you look at some of the comments that I get to see, the privilege of seeing some of the comments of our patients, and they really connect with their providers. And I would say they don't see it as transactional, that they do have a great connection. And we have some pretty amazing physicians and advanced practice providers. But I think you're spot on about the emotional health of our patients. And I think that's something that primary care is really good at addressing. And so encourage people to talk about that and be forthright about any challenges, because there's a lot of really good resources out there for people.
Be forthright. Thank you for that advice. Absolutely. So if you were to give listeners one thing to do before the next appointment they have with their primary care, what would you tell them to do?
I would write down your questions.
I love that.
You get into the office and you forget. So write down what are the most important things for you to accomplish, and write down those questions so that you know. And then I think really come in with what's most important to you, and make sure that you're letting your physicians know that up front. And if you have concerns that you think are important, don't wait till the last minute. I can't tell you how many times I've had somebody come in and we have an entire conversation about their health, and I'm ready to leave. And they say, I've been having some chest pain over the last couple of weeks. You don't think that's a problem, do you? And so I have to come back in and sit down, because their biggest concern was their chest pain, but they're afraid to bring it up. Right. So I would just say, if you have those concerns, bring them up at the very beginning of a visit so that you can make sure it's addressed.
Thank you. Great advice. Absolutely great advice. How can we get individuals, and this is the biggest challenge for physicians like yourself, to be their own health advocates? I know that you've seen so many patients over the years, and you and I know that here you can give guidance and direction, but you can't really enforce, follow through. So how do we get them to be better advocates for their own health?
Well, one of the things I'm excited about that we're doing at HonorHealth is a focus on lifestyle medicine, which is really a focus on whole health and addressing all the components of somebody's health. So if I say to you, you need to go out and exercise and this is what you should do, it's not as helpful if I say, okay, here are a variety of different things you can do for your health. Which one appeals to you most? How might you address it? So what lifestyle medicine does is it addresses the key components of healthcare that people have choice of in terms of their behaviors, right? And then addressing those and then using coaching and motivational interviewing to really talk with your patient to understand what matters to them, how they can implement this, what their barriers are. And so really excited that we've had over 20 of our physicians and advanced practice providers just complete their lifestyle medicine certification.
Wow.
Myself included. So it was a great journey to really help understand there's 6 pillars of lifestyle medicine. But I think what's most important about it is that you connect with the patient on an individual level. And then you together kind of come up with what does that lifestyle prescription look like for you to address your needs, and then listening to helping you to understand how you can confidently go forward. And it may also involve other team players. So, the other piece that I love about it is, and I think is really important for healthcare moving forward, is it has to be a team sport. And so we may engage a health coach. There may be a nurse educator. There may be a pharmacist that's involved, or you may be referred out to the community to a dietitian or to a community program like Blue Zone. So you have an interest in walking, join a Blue Zone's walking moe that's at the mall in the summer because it's too hot. So that's what I love about lifestyle medicine. And so I think that's one of the ways that we can address it more globally. But I think it takes a little bit of time. And I think that's some of the challenges that we have in the current healthcare model.
I'm so glad you brought it up because as we were talking about Todd earlier, he talked about this. And matter of fact, there's an investment on HonorHealth's part for a physical place to do lifestyle medicine.
Yes.
I know he shared a little bit about it. I don't know if you have any more insight that you can share with our listeners and viewers here today.
I mean, I can share that, it's all coming in the next year. I think it's really exciting.
It's coming to Scottsdale.
It's coming to Scottsdale in the next year. And I think there are going to be a variety of different things that we will be doing to help support this whole health picture for people. We have, and our practitioners that were just recently certified are across the network. So it's not just in Scottsdale. And we also want to make it accessible to others. So there's ways to do that around shared medical visits, which I think is kind of, in a way, kind of creating your own little MOI, like we talked about, a group of people that may be managing a health condition, and they can learn from each other and kind of support each other. So that's one of the ways that whole health institute, I think, will work. But there's more to come. So stay tuned. And I don't know all of the details, but I'm really excited about it because I think it's an innovative way of helping patients. I know part of it will have to do with medical fitness. And so, a lot of folks that want to go to the gym, you can be a little bit intimidated because there's, maybe 25-year-old people jumping around at the gym that you just can't keep up with, or you have a medical issue that's limiting your ability to go to the gym and you don't know how to do it. I know there's going to be some components of that. It'll be medical fitness. And I think that'll be tailored to people who may be dealing with a medical problem or are just getting back to exercising and they need more support. So that's one of the things that I'm excited about, is that I think it's going to make health more accessible to more people and provide better support. Of course. I love it. Yeah. I mean, you can't have a lifespan without a health span, right? I mean, they go one and two together. They're part and parcel to one another. So yeah. Well, thank you. Yeah. I want to start winding down a little bit, but I've been doing this in my other podcasts, and I hope you're okay with this. That I want to do some rapid fire questions for you. All right. So you ready for them? I'm ready. I'm ready. Morning or night owl person? Morning or night owl person? Is that what you said? Yeah. Oh gosh, I've had to become a morning person. By nature, I'm a night owl, but morning is my go-to now. What's your go-to for starting the day? Oh, a little bit of coffee. I have to say, I'm in healthcare. We got to have some coffee, and then hopefully a little bit of exercise right after that. One word that describes how you want patients to feel after an appointment. Encouraged. I love it. A habit you practice for your own wellness. I I say exercise, but I think even more important than that, and it's something I'm committing to more for 26, is mindfulness.
Oh, I love it. Mindfulness. Favorite way to decompress outside of medicine?
Oh, talking to friends, connecting with colleagues. Absolutely. Social support.
A book or resource you'd recommend for health literacy?
For health literacy for clinicians, I would recommend the book Compassionomics. It's about how compassion makes a difference in healthcare.
Sounds good. Sounds like being mortal, right?
Yes, it's a good book.
Yeah, which is Atul Gawande.
Yeah. This is a book by two physicians that talks about why compassion matters, and how compassionate care improves quality, safety, and decreases burnout. And it's all evidence-based. So I know that's not a short answer, but it's a good book for anybody in healthcare.
All right, put that on the list. Best advice you've received as a clinician?
I think the best advice goes back to one of my attendings when he talked about taking a history. He said it's his story. So listen to the story of the patient, and he will tell you the answer, or she.
If you weren't a doctor, what would you be doing?
I think I would have probably gone into journalism. And part of that is because a doctor means teacher. Mm-hmm. And I don't know that I would have gone into teaching in the traditional sense. But I really like to help people to learn. And so I think journalism done well can be that. And I think that was why I was interested in the first place.
Very good. We're getting ready to wrap it up. Is there a question I haven't asked? Is a thought or a lasting thing you would like to leave for our listeners and our viewers here today?
Yeah, I think I'd like to go back to that lifespan versus health span, and just let people know that the choices that you can make, the small behavior changes, can make a huge difference on your health. And it doesn't have to be huge. It can be small steps. So we know that people that don't exercise at all, just starting to walk a little bit, that's the biggest impact that you can make. And so I just would encourage people to look at what are those healthy behaviors that you can make in your life, and just start little by little. And that will help to improve your health span. And we know that genetics are only a small part of what is going to impact our longevity and our health span. And it's these lifestyle behaviors. So find out more, connect around blue zones, and really just take a couple steps for yourself.
Here it is at the beginning of the new year. Mm-hmm. And you're not asking someone to go join a gym. You're saying to make a lifestyle change.
Yeah.
Baby steps.
And do it with somebody. Do it with a family member if you can, with a friend. Put yourself out there. Volunteer someplace. We have an amazing group of volunteers at HonorHealth. If you're looking for a way to connect, that's one way, but there's lots of them out in the community. Get out there and get connected to others.
Dr. Tiffany Pankow, I can't thank you enough for joining us here on Health Futures. Make it a great day. Have a great week. We'll be back next week.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com.